And this is an advisory that in fact is coming in as far as the Union Health Ministry is concerned over concerns of pneumonia cases that have started to emerge from China. So now we're understanding the Union Health Ministry is closely monitoring the outbreak of the H9N2 and clusters of respiratory illness in children that is being reported from China, as we pointed out. The Health Ministry as of now has gone on to say that there is low risk to India from both this avian influenza case being reported from China as well as the clusters of the respiratory illness. Also, the clarification and the reassurance that coming in is that India as of now is prepared for any sort of emergency situation. Let's go straight to our colleague Sharon Elizabeth, who is joining us. Sharon, post the COVID-19 pandemic, any such news is bound to send a lot of panic among people, not just in China, but across the world as well. Help us understand the advisory that has come in from the Health Ministry as far as preparations in India are concerned.
Well, as far as India is concerned, in the backdrop of the H9N2, the influenza-like illness that is being experienced in China, India has in fact held a meeting with the chairmanship of the DGH, and they have in fact come to assess the entire situation on ground. And they say that the overall risk assessment indicates a low probability of human-to-human spread and a low case of fatality rate as well. Keeping that in mind, they have in fact said that there is very low chances of such spread happening, but at the rate.
We'll just get Sharon back, but as Sharon is pointing out, that's the word that's come in from the Health Ministry, saying there is no need to panic because there is low risk as far as India is concerned. And also, India does have all the preparations in terms of any emergency situation. Remember, you've also gotten a word coming in as far as the WHO is concerned, who've listed out these precautions. The WHO has gone on to say that you should keep your distance from people who are unwell. You should reduce the risk of respiratory illness. You should stay at home when you're unwell. You should also get tested and take medical care as and when needed, and also try and wear a mask wherever appropriate. We'll keep tracking all those developments.